Hi, and welcome to the School Health Educators Podcast, where we discuss health education and how to best teach health ed in the K 12 setting. Hi, and welcome to the School Health Educators Podcast. I'm your host, Lori Reichel. And Happy New Year to everybody. Happy 2026. To start off this new year, I thought we'd increase our intelligence on some things that I've been hearing more and more about through journals. I know things keep on showing up on my social media feed about stress and this thing called the vagus nerve. So this episode is going to focus on that with somebody who I met recently at the New York State AFERT conference. If you listen to past episodes, you know I'm a supporter of people attending conferences to stay updated, including their state ones, and also to network. And so I asked somebody who I met, I went to her session, and her name is Paula Youmell. Thank you so much for being here today, Paula. Would you like to say hi to our audience?
Hi, everybody. Thanks for being here. And thank you so much, Lori, for having me here.
I am looking so forward to talking with you because when you presented at the conference, you talked about a subject that not everybody talks about or is aware of. Before we talk about that, do you mind explaining a little bit about who you are, what your background is?
Yes, sure. So I started out professionally as a registered nurse. I went to nursing school right out of high school. And it's interesting. I won't go into all the details, but my intention was never to be a nurse. I knew that I wanted to go into health and phys ed because of a teacher that I had who I absolutely adored. And I knew I was going to follow his path. But I got sort of sidetracked into nursing school because that was the college most of my friends from high school were going to, which was perfect. That nursing background has been perfect. 3 years later, after graduating from nursing school, I went to SUNY Cortland, got my health ed degree. Then I went off to Syracuse University to do my PhD, which I thought I was in phys ed. And I decided I was just going to get a master's in adult fitness. And I'm also certified in school phys ed and move on. So it was many years later, I think I was 58 when I finished my doctorate, and it's in psycho-spiritual counseling, which brings in the vagus nerve.
Wow.
So, yeah.
I have to say, I didn't realize you also went for your doctorate because that's a perseverance thing. If anybody's going for their doctorate, just get her done, as I was told repeatedly. And your title of your degree was what again?
Psycho-spiritual counseling.
Wow.
Yeah, so it's a lot of yoga, energy medicine. It's the vagus nerves and total health counseling. So I've also trained in functional medicine. As a functional medicine RN, and I have 2 certifications in herbal medicine, and I'm seriously thinking about doing another one because this teacher I just adore, and learning never needs to stop, right?
Absolutely.
So I know I can learn a lot from him to go beyond what I already know after 40 years of working in herbs. So yeah, that's just a piece of it. When I was in nursing school, and I kid you not, my very first day in the clinical setting in the hospital, I was appalled at the way we were taking care of patients in the hospital. This was like literally my first day there. And I knew then I needed to get on the preventative end, and I needed to do what I said I was going to do in regards to health education. And my elementary health phys ed teacher that inspired me. So I finished nursing school, even though I didn't want to. I mean, that was day one in the hospital and I wanted to walk away. But then I did go back for my health education because I knew I needed to access kids to teach them for preventative reasons. And if I could inspire them to keep themselves healthy, then I knew that, we could create a much healthier world if kids understood that from a young age.
I appreciate you saying that, and we're going to have a cup of tea one of these days in person because I also was doing pre-med or going into the medical, and I was like, no, prevention, prevention.
Yes.
And so why for you, children and youth?
I mean, working with adults, we can get pretty stuck and this goes back to the vagus nerve, get stuck very much in our neural pathways of way of doing things and not wanting to change. And if kids can be introduced to new ways of being and thinking and living, they're more likely, even if they don't do it then because they're not in control of their lifestyle at home. But if you just plant a little seed in their head, when they get out in the world on their own, that can blossom. I mean, those things will sprout and grow in the people they're supposed to. I know there's students I had no impact on, and they had no desire to go beyond their ho-ho Twinkies, Pepsi, that sort of thing. But I also know we do have a lot of impact on a lot of students. So.
And before we go to the vagus nerve, would you define what is functional medicine?
Functional medicine it's a very holistic way of looking at your health, which is the path I've walked, natural medicine, holistic medicine. So for instance, with lab work, this is just a very small piece, but with lab work, generally speaking, and I say this with much kindness, a medical professional will look at the lab work and see if it was flagged as either high or low compared to the norm. And then if everything is in the normal range, that's fine. Your lab work's fine. Whereas a functional medicine practitioner will look at it and they'll look at each individual lab marker and say, I'm just going to say like your MCV and MCH in your CBC. If they're on the low end of things, that's indicative of something. So it would flag you in your head. Even though it's within the normal range, it would flag you in your head. I'm going to look at this as well, whether it's ferritin level or thyroid or whatever it is. I'm going to look at this as well. Because if there's a pattern of low lab or high lab results, it is early indication of moving into metabolic, problems within the body. And so it catches things sooner than just saying, oh, yep, your lab works fine. Everything's within normal range and moving on. That's just one piece of functional medicine. And then the whole holistic part is not, here, you have these symptoms, take this drug. It's, you have these symptoms because of what you're doing in your lifestyle. Let's get behind that root cause factor. Let's change your lifestyle medicine and let's move forward so you can heal. So it's that sort of mindset.
Thank you. So I'd like to focus the rest of this episode on the concept of the vagus nerve. Again, I've been aware of it for some time, and it keeps on coming up in social media feeds. Of course, if you click on it once, things are going to pop up.
Right.
Yet it seems like people are becoming more aware of this nerve and things that have gone on in the past or present. So would you mind giving an overview about what's going on or even what is the vagus nerve?
So the vagus nerve is one of our major nerves. It starts in the brain and winds itself around the face, down through the body, and it innervates every organ within your midsection. And there's so much, it's another thing, like my herbal medicine wisdom. I know there's so much more I can learn. But this nerve innervates everything to do with, from the brain down through the body. It sends messages to the organs sends messages back to the brain. It's part of the parasympathetic nervous system, which is the rest and digest, the be in calm space, as opposed to the sympathetic nervous system, which is all about go, 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 fight, fight, fight. There's a stress in my environment and I need to either fight it or flee it or whatever. And so the vagus nerve really controls our being present here in the moment, here and now. And I became very aware of it. So I was 35 My first child was a year old, and I decided that I was going to go from lifting weights every day to a yoga practice. And I did it just for physical fitness. Okay. We're health and physical educators, right? Do it just for physical education and not even thinking. I had no clue. I just did it to keep my muscles strong. Within a couple of years, I started noticing, and I know that seems like a slow thing, but I wasn't looking for this, but I started noticing that had a much more calm present. I wasn't relying on running for something sweet to soothe my boo-boos, emotional boo-boos and feelings and that sort of thing. There was so much about myself that changed that I didn't even realize. And this was even before. So we're talking, maybe I was 36 at the time. Now I'm now 60. This was long before anybody was talking about the vagus nerve. I just realized this yoga thing is really calming me down. I have a more calm emotional presence. I'm able to like pay attention and make choices instead of reacting in anger, which was something that was a pattern that was part of my upbringing. You know, if something wasn't going the way you wanted, you explode and yell at people, and I was just to this calmer presence. So, you know, fast forward 10 years ago with all this conversation that started happening around vagus nerve, and this light bulb went off in my head. Oh, when you started doing yoga postures, there's this deep breathing that comes with that. And so you've got this physical manipulation of this nerve that runs through the middle of your body, and you're twisting it and bending it forward and bending it backward with these yoga postures, which manipulates. This is going to be a little bit weird, but it manipulates the feelings that get stuck in our body, the energy that's present within our nervous system that gets stuck there. You're manipulating it with the yoga postures, and you're bringing your vagus nerve into the forefront of your being with the deep, slow breathing. And with those two things, I was changing how I functioned and I didn't have this awareness of vagus nerve stuff. And so now here I am, 30, well, no, wait, do the math, Paula. 26 years later, my oldest son is 26. And it's profound for me. In fact, I've written a couple of books in regards to this mindfulness, energy, medicine, feelings, and coming into a space of acting instead of reacting. It's life-changing. It really is.
Currently in schools, a lot of focus is going on to SEL, the social and emotional learning. And I find it so interesting that emotional part is challenging, because it's like sometimes, even today in the year 2026, people don't recognize how they're feeling, or they suppress it. Even children. It's like, let's constantly, I don't want to feel this. Instead, let me do this. Let me binge watch something on whatever, Netflix or whatever it is, Hulu, or let me be on social media for hours. So we're not even connected to our feelings, which is why in school health, we're attempting to teach young people how to recognize the feelings, and then even to say it. I feel this, showing them a feeling wheel so they can even point to feelings. Because it's funny, when you watch some shows and they're trying to model I feel statements, there's a lot of shows that do it incorrectly. They'll be like, I feel that you're not listening to me. And it's like, no, tell me what you're feeling inside your body.
Right.
And so is that one of the things that hurts our vagus nerve, that we don't allow ourselves to have the feelings? We cover them up. We suppress them?
We're suppressing them. Yes. We're suppressing them. And those feelings create, it's energy that stays within the body. And that we know now that when we harbor those emotions and feelings and we suppress them, push them down in the body, and they, for lack of a better word, they build up and they constipate within the body, they are contributing factors in disease down the road. We know that now. And so when we can verbalize what we're actually feeling, the actual feeling, not like you said, that I feel like you're not listening to me. That's not a feeling. That's observing a behavior. but it's not a feeling. And coming into that space to really verbalize your feelings, because you're like, you start crying as a child and you're handed ice cream, it's okay. that, and we're trained very early on that we don't want to see your feelings. That's too messy. Okay.
I have to say this out loud, and I'm going to leave it in this recording. I have heard the phrase, "it is what it is," for so long. And I'll hear that and I'll feel frustrated and go, wait, whoa, whoa, whoa. How about saying, and excuse my unprofessional language for a moment, how about saying, you know what? This sucks.
Yes.
I feel yucky. Let's say it out loud. And I'm not saying to sit there and complain for hours, yet to recognize some stuff is happening that I'm not liking is okay. It's healthy.
Exactly. And what kind of action can I take to be in a better space?
Yes. Well, how can I take care of the vagus nerve so I can be a healthier person?
Well, so years ago when I was realizing this was happening because of yoga, not realizing that it had anything to do with this vagus nerve thing, I started talking to people about creating this conscious interconnection. And for me, and I'm going to be very honest about this, for me, it was yoga. For some people, it's meditation and prayer. Woods walks, walking in the woods quietly by myself, that's a big piece for me too. Some people, it's Tai Chi, Qigong, Taekwondo. There's so many things. Sitting and reading the Bible while you're deep breathing, relaxing. It's that deep breath coming through the body that helps to tone the vagus nerve. So, I'm not going to run around the world and tell everybody that they have to do yoga, because I've had so many people that I suggest that to. This is the tool that worked for me. And then come back to me and say, I don't know, that doesn't feel right to me. That doesn't work for me. That I can't commit to a daily practice for this. So it's finding that practice that brings you into that state of inner conscious connection. And then we are tuning into the vagus nerve. We start listening to our feelings. We start listening to what's going on within our body. And it's not just feelings, like emotional feelings, but we start feeling the physical feelings in our body, and it helps us to release those past negative, heavy energy, trauma feelings, whatever you want to label them as. It helps us to release that as the physical pain that we're feeling, physical symptoms.
Well, thank you. You just reinforced why I have graduate students taking a winter course right now at SUNY Cortland. You're reinforcing one of the assignments I have for them, which is a 30-day challenge of doing something for 10 minutes a day. You can start off with 5, but you can go to 10. It needs to be a mindful practice, and I provided a whole bunch of resources for people to look at. Yet it's not to go out for a jog, nothing against that. And I know some people can be mindful when they're exercising, yet go out in nature, go out and let's see if you're noting your body's a little different, your responses are a little different. So I appreciate talking with you. I love talking to other passionate health educators who keep updated, and this is so important. If somebody wanted to find out more information about the vagus nerve, do you have recommendations for them?
Oh boy. There's really good courses if you've ever heard Daily Om.
Mm-hmm. Yes.
So there's really good courses through Daily Om that are relatively inexpensive. And I would say that would be a great place to start. There's books.
If I can stop you for a moment, and how you spell that is daily, like the word daily, news, daily, and
yes.
O-M.
Yes. Om.
Very good.
Yes.
Wonderful.
Yeah, so that's a great website. And then there are plenty of books out there. So I shouldn't say there are plenty of books, but there's certainly books out there that you can read about the vagus nerve. And it's funny to me, the vagus nerve wisdom is, it's as old as humans. And I'll give you an example. Most of my nursing was in maternity nursing. And one of the things that we always taught moms in labor and delivery was to keep the tongue on the roof of the mouth. Well, now through yoga, I have learned that tongue on the roof of the mouth stimulates the vagus nerve, which runs down through the whole body, ends in the pelvic region, and that tongue on the roof of the mouth keeps the vagus nerve relaxed, keeps your pelvic floor, your pelvic organs relaxed, so that everything can open up for birth to happen peacefully. And that wisdom has been around forever. That's vagus nerve wisdom.
Do you talk about the vagus nerve in your books?
I I do in the last book I wrote. It's called Sacred Circle Shamanic Yoga. That I talk about the vagus nerve a lot in, and various ways using yoga, breath work, nature, the practices of being in nature and learning about the cycles of nature, how that is linked to the calming presence, that inner conscious connection of vagus nerve, peace mode, create constant calm. I've labeled it many ways over the years, working with people in health education and trying to, you have to try and connect with what's going to catch the crowd you're working with.
Right.
So yes, that's the first book. I've written 4 books. That's the first book that I actually used the term vagus nerve in a book.
Do you mind mentioning the other books that you have?
The first book I ever wrote, it's called Hands on Health. It is literally a primer in lifestyle medicine, nutrition, nourishing the body with real food and the activities, the lifestyle medicine of our day. It's a primer because I got tired, and I say this very lovingly. I was saying the same things over and over to clients, and I thought, okay, if I can just hand them this book, this is your primer, get started, read it, come back to me, and then we're going to analyze your whole lifestyle medicine and we'll fix it. We'll teach you how to fix it if you choose to go that path, that sort of thing. So that was the first book I wrote. The second book I wrote, which is no longer in publication, is called Coffee and Donuts. And it's funny to me because I think about this now. It's just 52 inspiring words that my intention was that people would focus on one per week and read it every morning for a week. What is that? It's bringing yourself into the vagus nerve and inner conscious connection, thinking about that. And the vagus nerve wasn't even part of my wheelhouse at that time. That is a book that I plan on republishing when I get to it. Right now, I'm working on republishing this book that I wrote with an educator. She's a K through 12 educator. This book was her idea, but it's all about mindfulness. It's weaving healing wisdom. It's all about the mindfulness and practices to bring you into that inner conscious connection. And that one we are working on right now, republishing. And then the last book that I just wrote, Sacred Circle Shamanic Yoga, is very much about the vagus nerve and accessing it and using it for our own self-healing.
Wonderful. Thank you for sharing those and for creating those for people to read more about a different type of health they might not have been raised with.
Absolutely. That's it. That was my intent.
So I have a fast kind of question for you. How does technology, I know at the conference you had mentioned that in a classroom setting, you're not a supporter of technology. Me too. You can ask my students, I'm like, put it away. If you have to do group work, yes, you can take out your computers at that point. But overall, I like for you to be present.
Yes.
What are your thoughts on that?
Well, I've taught in five public schools in New York State, and I never allowed my students to use technology. I didn't want them using technology for homework. They weren't allowed to use it in the classroom. It was one of the biggest things that I got in trouble for when you had your 6 months reviews is I wasn't using enough technology in the classroom, and I used to crack up and say, I don't use any. And that was always one of the comments that, to up your review, you need to start using more technology in the classroom. And I always said, it's not going to happen. So if that's going to be a reason that you get rid of me, fine. Technology is very fast moving information, very fast moving images. That accesses the stress response in the body, the sympathetic nervous system. Mm-hmm. It keeps students constantly in sympathetic nervous system overload. It's taking them right out of that inner conscious connection. It's taking them out of that constant calm within their body. And so it takes them away from using like their imagination, their intuition, their discernment. And I like relate it to fast and slow twitch fibers of the muscles. We're using that fast twitch part of the nervous system all the time, and we are meant to be using the slow twitch part of the nervous system. That is what we are meant to function in 99% of the time, and only that's, sympathetic when we need it to run, to fight, flee. Mm-hmm. And so I didn't want to be a part of that. I also thought that kids need more human connection, and you cannot connect human connection wise. They need to feel the energy, the feelings of you as a teacher, as a mentor, as a role model guide in the front of the room. They need to feel the energy of you and what you are present there to share with them. And technology interferes in that as far as I'm concerned. So I wouldn't have any part of it.
Thank you for explaining that. And I'm a supporter of that. I know there are some educators that are not able to do that because they do choose to maintain that job. They have to maintain a job at times. So I support that. Yet, yeah, I love the awareness of not always the healthiest for our nervous system. So thank you so much for bringing that up. And before we end today, is there anything else you'd like to share with our listeners?
I don't think so. I think this has been really great. I thank you for having me here and asking me these questions. I thank you for the opportunity of sharing my books and my work in the world. If we just put our best feet forward for ourselves first, because then we are better educators. And then that will be seen and picked up by students. They know when you are authentic in your being, in the information that you present, and the way you carry your own life.
Well, I thank you so much for being here today, Paula, and I will make sure that we have information for how people can get in contact with you. We'll have that in today's episode's description. Again, I thank you so much for being here, Paula, and to our listeners, I thank you so much for listening in. Hopefully you've learned something about the vagus nerve and the parasympathetic nervous system, if I can only say it. And like usual, please check out the School Health Educators website. And if you could give a couple of thumbs up or 5 stars for the podcast, I would really appreciate it. And continue doing what you're doing. The kids need us. So thank you for doing what you're doing. You are an important piece to the puzzle. And thanks for listening in. Enjoy 2026, folks.